Hi, my name is Philip McGee, and I'm a physical therapist of 15 years that is board certified in geriatrics. And I'm going to provide my final reasons why I've left clinical physical therapy. If you haven't seen my first two videos, I'll post the links down in the description. Today, I wanted to talk about the physical demands of being a physical therapist, the desire to want to learn a new skill, the benefits that come with being a non-clinical physical therapist, and lastly, I'm going to touch on what the job outlook is for physical therapy. When it comes to the physical demands of being a physical therapist, I have spent most of my career working in the acute hospital setting and the home health setting. I have also worked a little bit in skilled nursing, but in all of those situations, there's a lot of manual lifting that is involved. Especially when I worked in the ICU, there was a lot of need to perform maximal to dependent lifts for people that were just starting to get moving out of the hospital bed. And in home health, there are no techs that you can use to assist you if someone needs a significant amount of assistance to transfer. So I was seeing that as a therapist that is currently in his late 30s, that if I'm going to look at my physical abilities 10 years, 20 years from now, I wasn't sure how well I could hold up. And I've been very fortunate to have good health. I haven't had any debilitating pain that has stopped me from being able to work with patients, but I have seen that pain is very complex. It's not where it's something that you can just say it is one thing typically. It's biopsychosocial, that there's many aspects to how pain affects us. And I was seeing that if I'm going to remain a physical therapist, seeing patients on a daily basis, then I'm going to risk the possibility of having injury later on as the demands are unsustainable. As I started to see the reasons growing for becoming a non-clinical physical therapist, I saw the need to want to learn a new skill. And back in 2020, I obtained what I felt like was the pinnacle of accomplishments clinically and became a board certified geriatric clinical specialist. And after obtaining that, I saw that there were other options that I could do that weren't involving being a clinician, being a manager, being a professor. And in 2021, I started to see that there were options in utilization review. And utilization review sounded very intriguing because it could combine my expertise in geriatrics while also being able to not experience all the downsides of being a clinician. In addition to that, I could learn a completely new skill while not needing to obtain a new degree. I will talk more about utilization review in future videos, but for now, just to explain what utilization review involves, it's looking at charts and trying to make sure that the right amount of physical therapy is being provided for each member. As I started applying for utilization review jobs, I started to see that there were better benefits that were provided compared to what I had experienced as a clinician. The biggest being a better work-life balance. As I mentioned in my first video, that was one thing that was making me want to seek a non-clinical career. With the role of a utilization review pre-service coordinator, I was going to be able to have a set schedule that was Monday through Friday, 8 to 5, and I didn't have to worry about work before work or after work. It was just work was during that 8-hour time period. and that was very appealing to me. In addition to that, there were better medical benefits, that I was going to pay less for my premiums to have better insurance, and part of that has to do with working for a company that is partly owned by an insurance company. Other benefits include being able to advance in the company, that I wouldn't have to just focus on my current role or becoming a manager, but that there were more opportunities, that if I wanted to branch out and learn a new skill, that I could do that. I wasn't stuck in a job and had to maintain that for the rest of my time with the company. And also there was more PTO that was available, and that I could work anywhere that I wanted to in the United States if I had a remote job, as long as I could maintain HIPAA compliance. And all of those things were something that no clinical career could really offer me. The last thing that I wanted to talk about today involves the future of the physical therapy job market. I'm going to create a separate video on this because I believe this is a topic that isn't really being discussed much in the physical therapy community. And in May of 2021, there was a report that came out that said that the physical therapy job market by 2030 is going to be oversaturated. And that's disheartening because all of my career, I've been told how there's such a great need for physical therapists, and that there will always be a need for physical therapists. And it was disappointing to see how they calculated and found out that based on current trends, there's going to be an abundance of physical therapists. Thank you so much for watching this video. If you've made it this far, please like and subscribe. I'm going to have more content as far as non-clinical careers and what it is like being a full-time non-clinical physical therapist. And I do have a website, Non-Clinical Career Guide, as well as a Facebook group. I do resume reviews and interview preps. If you would like to sign up for those, I will have the links in the description. And I hope to see you in the next video. Thank you very much.